Good morning. Today we have here in Fascial Manipulation Institute Dr. Caterina Fede, a biotechnologist postdoc at the Department of Neuroscience of University of Padova.
Thank you. Good morning. Thank you for the invitation. It's a pleasure to be here to explain our research about fascia.
Can we do you some question about your research?
Surely, yes.
Okay, fascia was considered an inner tissue. Which are the recent evidence about the fascia, its characteristic and its modifications?
Yes, fascia is composed of different kind of cells which express different receptors. So fascia is not an inner tissue, but it is able to understand the extracellular environment and to adapt the synthesis of the extracellular matrix around the cells according to the different situation. In fact, the fascial cells express receptors for the sex hormones, for the cannabinoids, and so the fascial tissue can adapt to different conditions, changing the amount of collagen, the amount of elastic fibers, the amount of hyaluronan, and so changing the different characteristics of the fascial tissue.
And about the opioid crisis in the US, the latest research on fascia can open new therapeutic options?
Yes, we think so, because we have demonstrated that the fascial cells express the cannabinoid receptors, and so the fascia can be a source of pain and a modulator of pain. In particular, cannabinoids can be used for treating pain, especially chronic pain, because they can have a direct peripheral effect on the fascia. We have demonstrated that treating the fascial cells with some cannabinoids, fascia is able to synthesize vesicles of hyaluronan in a very quickly way, and so to change the characteristics of the fascial tissue that can become more soft.
And according to your recent studies, do you think that dysmenorrhea can be linked to the fascia?
We think so, because the fascial cells are able to adapt also to different conditions of sex hormones, because they express the receptor for sex hormones, especially estrogen and relaxin, and so we think that when there is a balanced situation of sex hormones, the fascial cells are able to synthesize the correct amount of collagen and elastic fibers. But when there is an unbalanced situation and when a patient has some hormonal dysfunction, the fascial cells produce much more collagen type 1, and so the fascia becomes more rigid and we can have much more pain. Or in the opposite situation, the cells can produce much more elastic fibers and collagen type 3, and so the fascia becomes more elastic.
Fascia have a huge innervation. Which are the implications in myofascial pain?
We have demonstrated that fascia has a very huge network of innervation, confirming its sensory role and its role in proprioception and also in nociception. And furthermore, we have demonstrated that the fascia have a huge amount of autonomic innervation, and this can help to understand why the chronic stress can increase the pain in some patients, because the chronic stress can influence and activate the autonomic innervation, creating much more pain.
Okay, so thank you so much for your time and for being here with us.
Thank you to you.